Hello everyone. This presentation by Anne Carlisle, Gabriela Quintana, and Alexandra Smar will look at the evaluation plan for Contra Costa County's Opioid Multi-Agency Response Initiative. This presentation will review the evaluation plan for Contra Costa County's Opioid Multi-Agency Response Initiative, or OMRI, including the program background, aims of the program, the evaluation and use of the evaluation, key evaluation questions, as well as a presentation plan for the evaluation. According to provisional data from the CDC, in 2021, more than 71,000 people died from synthetic opioid-related drug overdose in the United States. Based on preliminary data, there were nearly 7,000 opioid-related overdose deaths in California in that same year. Contra Costa County is a fairly large county located in the San Francisco Bay Area, spanning over 700 square miles and boasts a population of 1.16 million people. According to Contra Costa Health Services, the county has seen an increase of opioid overdose deaths in recent years. OMRI is a novel program designed to reduce the number of opioid-related deaths in the county. There are multiple components of this program throughout various aspects of the system. Through funding from the Substance Abuse and Mental Health Services Administration, EMS, or Emergency Medical Services staff, will receive training about opiate use disorder and other substance use disorders to provide the best treatment options, support, and resources to individuals in the community. First responders will be equipped with naloxone and buprenorphine to administer to individuals in the field, as well as distribute leave-behind naloxone kits and provide education to individuals and groups of people. Carrying and knowing how to use naloxone, an anti-overdose drug, is a valuable tool in overdose prevention and especially important for family and friends of people who are struggling with opioid misuse. Distribution of kits paired with education is a key component of the prevention portion of the OMRI program. Another component of the program focuses on ongoing support and education for individuals who have had an overdose through outreach by the county's Substance Use Navigators, or SUNs. The SUNs reach out to these individuals to provide education, resources, and linkages to care, such as medication-assisted treatment, or MAT, with the intention of preventing any future overdoses. As a new program, an evaluation is needed to ensure resources are being effectively utilized throughout the community and contributing to program goals.
A logic model serves as the foundational piece of a program evaluation. This logic model was created based on the intended outcomes and available information of the OMRI program that we were provided. As you can see, the logic model includes inputs, activities that were planned for the program, the outputs that come from those activities, as well as short-term, intermediate-term, and long-term outcomes for the program. This model that we created was then utilized to develop our evaluation questions, which will be explained in further detail. As you can see, the components of this program that we will be evaluating are circled here on the logic model in red.
We will now look at the evaluation plan for OMRI. As a new program, this evaluation is necessary to ensure resources are being effectively utilized throughout the community and program activities are contributing to expected outcomes. A thorough evaluation of OMRI should identify how informational and preventative measures such as naloxone distribution and education all play a role in the overarching goal of reducing opioid overdoses in Contra Costa County. As a multi-agency collaboration, all involved entities will play active roles in the evaluation, as data and information will be needed from EMS, the county health department, and hospitals.
This evaluation will have three main focus questions. One question will be focused at the process level of the program, while the other two will be focused on the outcome levels of the program. Question 1, which is a process level evaluation question, is what barriers have the paramedics faced when distributing naloxone kits to people in at-risk neighborhoods? The second question, moving to the outcome levels, is a short-term outcome question. To what extent does the program increase knowledge among the use of Narcan among community members? The third and final question is an impact level or long-term outcome level evaluation question, which focuses on the program's effect of the overdose death rates in Contra Costa County. This evaluation has components that were pulled from the earlier stated logic model. The first component is an output, where the target population is paramedics within Contra Costa County, which will look at the number of Leave Behind naloxone kits distributed by paramedics to at-risk community members. The second logic model component that will be evaluated is a short-term outcome. This also looks at participants of Contra Costa County population, which will look at the extent to which the knowledge is increased around the use of Narcan among community members in the county. The last logic model component is a long-term outcome or impact, which will look at participants, which is also considered Contra Costa County population members, and will look at the number of opioid overdose deaths.
The first evaluation question is, what barriers have the paramedics faced when distributing naloxone leave behind kits to people in at-risk neighborhoods? To obtain this information, a one-group post-test design will be used, as a comparison group is not necessary given that this is a process-level component. Mixed method will be used, so the quantitative piece will look at information such as the number of kits distributed and the zip codes where they're distributed, and will utilize a distribution information form that the paramedics will fill out upon distribution. The qualitative component involves a county-wide focus group sessions via Zoom meetings with selected fire stations throughout Contra Costa County. The data that we're interested in is the number of leave behind naloxone kits to be able to answer and look at, are the intended amount of kits to be distributed actually being distributed? And in terms of the zip codes where they're being left, are they being left and distributed in the at-risk neighborhoods that have been identified? The focus groups intend to better understand the barriers that the paramedics are seeing when they're in the field distributing the kits. So the facilitators will really use open-ended questions to get this information and ask things like, what are you most surprised about when you are distributing these kits? Or what are some of the reasons that people decline to take the kits? The meetings will be recorded, which allows for a easier way for the program participant or the program evaluators to analyze the data. This is also an efficient way to obtain this information because travel time is not necessary and the firemen and paramedics are already together in the fire stations. Like I mentioned, the distribution information form will be used to obtain the quantitative data, and it will be analyzed quarterly throughout the 2-year pilot program. The qualitative tools, again, will be the Zoom meetings for the focus groups, and that information needs to be looked at more closely for the first 6 months. So it will be monthly, which allows the program to make adjustments as necessary, and then quarterly after that.
The second evaluation question seeks to answer, to what extent does the program increase knowledge around the use of Narcan among community members? A 2-group pre-test post-test design will be used to obtain this data utilizing a mixed methods approach to combine quantitative and qualitative data comprised of short surveys distributed throughout the county, as well as focus groups to gather input from intervention and comparison groups. Quantitative survey distribution methods will include both physical and digital copies handed out at the planned focus groups, as well as posted throughout the community in public spaces such as libraries and recreation centers. Qualitative focus groups will be accessible in person or virtually, both of which will be incentivized with food and/or gift cards. The quantitative data will provide information related to demographics and contact information for follow-up data collection, as well as a Likert scale rating self-assessing knowledge of Narcan. The qualitative data will provide insight into participants' knowledge and change in knowledge related to how to access Narcan, how to use Narcan, when to use Narcan, how Narcan works, and what to do after using Narcan. Looking at the tools and timeline, the first step is identifying the program participants, which in this case is the entire population of Contra Costa County. At the same time, we need to identify the comparison group, selecting a neighboring county with similar populations and overdose rates who do not have this program in their county. As soon as these groups are established, recruitment efforts will take place within both counties for participation in focus groups and surveys to evaluate the group's current understanding and knowledge of Narcan and overdose prevention. Throughout the implementation of the project, surveys and focus groups will be carried out annually, utilizing the same tools as used in baseline data gathering to evaluate knowledge of Narcan throughout and after the program.
The third question of focus for this evaluation is focused at the impact or long-term outcome level. This will focus on to what extent the program has affected the overdose death rates in Contra Costa County. For this question, it will be answered utilizing both qualitative and quantitative methodologies. A multi-group time series will be utilized where Contra Costa County will be compared with a county of similar demographics and size in the Bay Area that does not have a similar opioid overdose reduction program to see if there is an effect on the overdose death rates based on the program. The methods for this question will be mixed. Quantitatively, secondary data collection from hospital records and death certificates will show numbers of opioid overdose deaths. Qualitatively, county-wide focus groups will be utilized to get a deeper justification for the program's effectiveness. Quantitative data will include pre- and post-intervention data for each county, one Contra Costa and the comparison county, for the number of opioid overdose deaths for comparison. Qualitatively, the focus groups will get at the notions of impressions of the program as a whole, if and how tools that were provided for the intervention program were utilized by participants, and how participants felt the program had impacted the community in terms of opioid overdoses. For the quantitative data, 3 years pre- and post-intervention data will be collected for the hospital and medical records, including death certificates. This data will be collected at 1-year intervals, pre- and post-intervention. Qualitatively, the focus groups will have targeted open-ended questions for the participants to get their opinions of the intervention program. This will take place for 1 year post-intervention, where focus groups may be held at any time frame to get as much qualitative data from participants as is possible.
The next few slides will lay out the presentation plan for the findings.
The presentation of the evaluation to the specific stakeholders within the program will have a couple of different components. In terms of the quantitative component, tables and charts such as this will be used so that it's easy to understand the implications and findings from the evaluation. For instance, the distribution of Narcan kits on the left, you can see what was expected and what actually happened. On the right, using something like a pie chart, it could easily show what zip codes were represented in terms of the distribution. Similarly, a chart could be used to present the data about knowledge of naloxone administration amongst the program participants. Something like this would be a good way to see what the participants rated pre-intervention, pre-test, and how they rated themselves on particular questions post-intervention. And this certainly could be elaborated with comparison groups as well, but an easy way to depict the information. Because the long-term goal of the program is to decrease overdose rates in Contra Costa County, a table such as this is really important to show the stakeholders how much and what the rates were of overdose in the county 3 years prior to the intervention, as well as 3 years post-intervention. Something like this could also be used to present data on neighboring counties to again further determine if this intervention is indeed impacting overdose rates. The qualitative data will be presented to the stakeholders in a different manner. And this is really valuable information as it gives the stakeholders insight into intricacies of the program and valuable information about what's happening and what people are thinking and feeling. So this will be presented in such a way that quotes from the participants and paramedics themselves will be shown. Such things like, "I was surprised by how many people declined the kits. Many people declined them because they said they already had them. I didn't realize how easy it is to administer naloxone. This doesn't really matter because people are going to continue to die unless there are more resources."
Thank you for taking the time to watch our presentation, and we look forward to continuing the conversation.